Welcome all, and this is this particular presentation, this AimExcellence actuarial presentation is actually showing you certain data, and if you minutely show this data, you will hopefully it is going to help you as a positive catalyst to take a right decision for your life yourself and career yourself. So important is that you see the data and then after you decide for yourself what is actually going to be helpful for you. We already have highlighted few facts regarding the counseling and regarding the decision that is going to help you in long run, not only for upcoming 3 years but also for future. So at this point of time we also want to reiterate few important points that I feel is going to remain very important for in upcoming days for you. Number one, take a clear decision whether you are okay with a clinical line or pre-para clinical lines. That is a very important decision. If you make a mistake right now, you most probably will not be able to forgive yourself for the rest of your life, because this is something which is the decision you are going to live for the rest of your life. It is going to shape your rest of your life. Number two, just don't go by the data that we have already shown you. Do your own research. You can check from the net and also from your seniors who have completed their post-graduation or the super specialization. If you have already done that and make a sure decision, really great. Regarding the college, regarding the MD DNB difference, it is very important that you talk with the senior of yours whom you can trust. This particular doubt has to resolve. Now, one important thing, whether you are going to remain in your state or you are ready to relocate somewhere else, that is also a very crucial decision, and take it with a calm mind after talking with your seniors. The pluses and minuses of this particular decision is going to remain very crucial. Now, joining certain states where there were recent unrest and those places if it is not your home state, then really give it a thought to relocate in a totally alien place. If it is your state, you will be able to cope up with that particular area much easily. In India, it's a multilingual country, and however it feels it's a one country, it's our country, but language is going to remain very much determinant factor. So give it a very sincere thought, particularly if you're going for a clinical line, because if you're not understanding the problem of your patient, you are most likely not going to do your post-graduation very easily. One important issue that we already have talked about, the private colleges, if you can afford, you can obviously choose to join that there, because that is also going to give you a 3 years to 5 years advantage for your super specialization. And obviously the data that we have shown that clearly shows the income factor always multiply with a super specialization degree, particularly if you have done in surgery, medicine, pediatrics, and also radiology. In the upcoming days there will be DM courses. 4 DM neuroradiologies are there, and DM courses are going to be more sought after. Intervention radiology, these all things are going to be very, very important in the upcoming days. Like MD, MS or DNB, this is very, very important thing, and we obviously already have talked about that. MD, MS, DNB, this particular thing you have to be very, very certain about the institute that you are going to join, because many persons who have joined DNB then after left that particular seat. These are the factors you should be very, very certain of, and you have worked very hard, and right now this is time to take a very crucial decision of your life. So hopefully that you are going to take a right choice for yourself, and most important decision that you are satisfied with the only clinical or with pre-paraclinical. Even among pre-paraclinical subjects, apart from pathology is the most sought after subject, because it is going to give you more chances to become an entrepreneur in the upcoming days. Pharmacology have a chance, but till now in India there are not many pharmacologists who have made a pharma company and made it a successful one. So this is one important aspect that you should focus on. And regarding the clinical medicine, even a MBBS in India, particularly in the 3-tier city, can jolly well expect a six-figure salary, not salary, but six-figure earning. They can expect if they are confident of their knowledge and skills, and particularly subjects like for a female gynae is going to be very, very sought after. And in India, there in the upcoming days there will be 5 SEER raise in the there will be in the upcoming 5 years there will be raise of 5 SEER infant. So you can understand how many deliveries are going to take place, and how many of them are going to be cesarean, and how many are going to be normal delivery. And depending upon that, you can understand the amount and the risk and the opportunities involved with that. This is a very, very important subject, and this is a 9% of the human body, and yet its impact on the 50% of the population is a very, very important subject. And apart from that, medicine is always going to remain the evergreen subject, and pediatric is going to remain the most sought after subject among the clinical subjects. And the people who have that passion for the Caesar and the scalpel, they will obviously choose a surgical line. And I have seen people who are actually passionate and in love with general surgery, and they don't stop by that. They actually go for their MCH and super specialty after that. Regarding one thing you should remember regarding the pre-para subject, is all the subjects are very, very rich subjects, all are very, very important. And I have seen mentors whom I have tremendous respect for, but at the same point of time, if you see the next one guideline, you can see the 10% of the questions are going to be from the pre-paraclinicals apart from PSM. So the weightage on the pre-paraclinical in PG preparation teaching is going to be lessened. This is the fact you should know, before choosing and thinking that you can teach after doing this in the post-graduation teaching. So this is one aspect you should keep a note on. And 10% is going to remain the PSM, because all the public health updates are going to remain very, very important. Apart from that, even in the pre-para subjects, which are questions that are going to come as the schedule that have been given till date and uploaded, that is, they are going to be clinically related. So most likely there will be surgical, gynae or medicine angle with every pre-para question in the next gen questionnaire, and which will be in the lines of USMLE or MRCP MRCS pattern. So one clinical line postgraduate or teacher will have more chances of teaching in PG entrance and the SS entrance in the upcoming days as the guideline till date. And that is the one important facet you should remember before just choosing a pre-para subject with a clear mind of teaching that subject. Because if you choose a microbiology or biochemistry and then after you think that you are going to teach that particular subject or physiology for that sake, think 10 times before making that decision, and hopefully all this input is going to give you a pretty clear idea, and you will make this will help you to make an informed choice. Anatomy is going to remain important, because any person who is coming to first year student, anatomy is going to be very alien subject. But even for the PG entrance, its importance are going to be related with the surgical branch, that is for sure. So these are the important aspects you should remember, and if this particular presentation actually help you to make an informed decision, that then the purpose is going to be served. Thank you.